And you're in tune with the Weekend in Wyoming program. Doug Randall with you, 11 to 1 every Saturday we do it. And right now on the phone I have our County Health Officer, Dr. Stan Hartman. Good afternoon, Dr. Hartman.
Good afternoon, Doug. How are you?
Doing pretty well. Of course, you're here to talk about the COVID-19 pandemic and our recovery plan. First of all, what are the latest numbers here for Laramie County? Any new information? Have we had any more cases diagnosed or anything like that?
Actually, the most current data for Laramie County are encouraging. We currently stand at 109 laboratory confirmed cases. That actually has not increased for 3 days, so that's very encouraging. But it doesn't mean that we should let our guard down prematurely. We have 54 probable cases, 76 people have recovered, and there's been 1 death. In Wyoming overall, we currently stand at 490 confirmed cases with 154 probable cases and 7 deaths. And except for Fremont County, where things are apparently heating up in terms of disease activity, the other counties in Wyoming seem to be relatively quiet at this point. But again, we really have to keep our guard up on this.
So understanding that it's a short-term trend, can we say that maybe it looks like the curve is flattening, or is it too soon to say that?
Well, I think the curve is flattening, and I have to give credit where credit is due. All of the various organizations, businesses, churches in Laramie County have really gotten on board with the limitations on economic activity, social activity, as painful as those limitations have been. And I think that really has made a difference. But we still have to be very careful in terms of going forward with loosening things up, that we don't have the disease come roaring back and all of a sudden start seeing a lot of people get sick. That's the last thing we want. As the governor said in his press conference just a couple days ago, you don't want to move too quickly and lose all the ground that we've gained.
Now, this week, Laramie County did publish a COVID-19 recovery plan. It's a 3-phase program, as I understand it. Kind of walk us through that a little bit, if you would.
Absolutely. First of all, this is the recovery plan dated May 4th, and we are already updating it. We expect to update it frequently as new information comes in, as we look through what we anticipate in the various phases. The recovery plan, as you mentioned, comes in 3 phases, and it mirrors the recommendations at the federal level to do this in 3 phases. Every time there's a little bit of a loosening, we have built in a 14-day period to watch for increased disease activity. We did a little bit of loosening on May 1st when we allowed limited reopening of spas, salons, gyms, etc. And so we're now about halfway through a 14-day period of monitoring local disease activity. The reason why 14 days was chosen is that the vast majority of people who get ill or become symptomatic from COVID-19 will do so anywhere from 2 to 14 days after exposure. So once we did a little bit of loosening on May 1, we're watching for 14 days before we consider going any farther, and that would put us at around May 15th. If things remain favorable as of May 15th, we can go into the first phase of the plan, loosen things up some more, and we can talk about what that might look like shortly. Then wait another 14 days, loosen things up some more, and we can talk a little bit about that, although it's a little harder to predict, it's farther in the future. Wait another 14 days, loosen up a little bit more. The one thing that's important to remember, though, is even if we go into phase 1 on May 15th, as I hope we do, it will not be a return to the normal that we knew back in January. There will still be a lot of restrictions.
And in fact, we don't know if we'll ever be back to the old normal, so to speak. Would that be accurate?
Yes, I think things will get a lot better. Nothing has been more painful or grim in the last few weeks. And all of us want to get back as close as we can to normal as quickly as possible. But we have to realize that in some parts of the country where they're loosening things up very quickly, they are starting to see a surge in cases. So we just have to be very, very careful about that. Public health is walking a real tightrope here. On the one hand, we want to loosen things up as quickly as we possibly can, get people working, get people back to church, get them out doing the things they want to do, but we don't want to do that at the cost of all of a sudden seeing the hospital fill up or the ICU fill up or anything like that. We just want to be very careful, but we want to move quickly.
Now, it does look, based on current numbers, like we might be on our way into moving into phase one if things don't change between now and Friday. Would that be accurate?
That is totally accurate. If things stay favorable, I think we can count on further loosening of a lot of the current restrictions as of May 15th, and that would be Friday.
What would that loosening of restrictions look like conceivably?
Well, let's just run down through a few things.
Okay.
And I'm going by, first of all, by the governor's remarks in his recent press conference. Let me start with restaurants and food service. He specifically mentioned the possibility of loosening up on indoor dining or sit-down dining, either both indoors and outdoors on patios. That would not be a return to the way it was in January, but it would entail limited seating, tables spaced far apart for social distancing, increased sanitation of silverware, plates, the waiters and waitresses masking so that they don't risk transmitting the disease to customers. Of course, customers have to take their masks off in order to eat. But there would be limited indoor and outdoor sit-down dining with guidelines. And that would also apply to bars and taverns, even standalone bars and taverns. They would have to limit social distancing at areas where they serve drinks, at bars, etc. And some of the same restrictions would apply to restaurants. Now let's move down to personal services. That would be hair salons, nail salons, massage therapy establishments, etc. They are currently open with some restrictions. That was done on May 1st. We think that the governor's new order will contain some further relaxation of restrictions on those types of businesses, but we won't know that until we see the order. Hopefully that will come out early in the week. Schools and universities, we expect them to continue as they are now. The two school districts in Laramie County have done a fantastic job of taking up distance learning to the greatest extent possible, and we expect that to continue for the remainder of the school year. Child care and daycare operations, we're not sure what the new governor's order is going to say, but I think some of them are already open with specific conditions. Gyms and fitness centers, there may be further loosening of those. That remains to be seen. And we continue to get suggestions and requests from those types of businesses. And then we get down to churches, recovery groups, civic gatherings. I want to take a few minutes, if I can, to talk a little bit about churches.
Absolutely.
First of all, when I talk about churches for this conversation, I mean all places of worship, whether they be Protestant or Catholic churches, synagogues, mosques, kingdom halls, any place where people get together to worship. I have to compliment the religious community in Laramie County. They have been extremely proactive about holding off on indoor congregation, and they've come up with some very inventive ways to still allow people to worship, whether it be by live streaming or drive-in services or something like that. Several of the churches in town have already sent us proposals for how they would see limited opening up for indoor services, and they've really done their homework. A lot of these proposals are actually quite good, and they've researched the CDC guidelines. And I also want to point out that none of the governor's orders specifically closed churches, but the churches have been proactive in stopping their indoor services for the safety and health of their congregations, and they have to be commended for that. But the one thing in the governor's current orders that does affect all organizations, even religious ones, is the limitation of crowd size. But again, the religious community has really stepped up to the plate and has been very proactive about this. And we are waiting eagerly to see what the governor's new order says about reopening, and we hope that if it mentions that, we can move on getting some limited reopening for churches also as early as the 15th. If the governor's order does not mention churches, we would be favorably disposed to looking at a variance for religious congregations, because we understand how important religion is in many people's lives, and being able to worship together is very, very important.
AM 650 KGAB, Cheyenne's #1 news talk radio station. You're in tune with the Weekend in Wyoming program. I'm Doug Randall. I'm speaking with Laramie County Health Officer Dr. Stan Hartman. And Dr. Hartman, of course, we were chatting about potentially going into phase 1 of the COVID recovery plan on Friday if all goes well. I'm trying to recall from the report, and if I recall correctly, even under phase 1, people will still be, or employers will still be encouraged to have people work remotely where possible. Am I right about that?
That's correct. People who can work remotely will be encouraged to do so. It will not be required. Because it's still a good way to limit possible spread of the virus, and that would still be encouraged. And I think a lot of people are finding that they actually sort of enjoy working from home when they can. There are, of course, a lot of people who cannot work from home, and we have to keep them in mind also. And that would include, obviously, healthcare people, emergency crews, ambulance crews, law enforcement, grocery store clerks, the people that collect our trash every week. Those people cannot work from home, and so we still have to be cognizant of the risks that they're taking.
What sort, and hats off to those people, by the way, absolutely, for being out there on the front lines. Are our local folks on the front lines, are they encountering any higher COVID-19 rates than the general population? Has it become a real problem, or do we know?
Well, so far, it has not become a huge problem. I think we've been extremely lucky here in Wyoming compared to some parts of the country. I think our relatively not too remote, but relatively remote location and our small population have really worked to our favor. When I say relatively remote, I mean we're not totally cut off. We have a major COVID-19 hotspot just to the south in Weld County, and their numbers are pretty interesting. But by and large, our relatively small population and our population and businesses and other organizations that have really gotten on board with the social distancing and limitations have really helped to, as you put it yourself, flatten the curve. We had, I think, 3 employees at Cheyenne Regional test positive for COVID-19, but I think they've all recovered. I spoke with one of them. She's fully recovered. She said it wasn't pleasant to have, but she got through it and she's back to work. But I don't think it's really hit the frontline people more than the general population at this point. And the grocery stores in particular have really been extremely proactive in protecting their people. They have plexiglass screens up in front of the checkers. All of the store personnel wear face coverings when they're on duty and interacting with customers. And so it's been really encouraging to see that.
Now, as you mentioned, Weld County, Colorado, not far away from us, has been hit hard. Would it be fair to assume the fact that we haven't been hit that way means a lot of what we're doing has been working?
Yeah, I have to give credit to our own local population who have really gotten on board with this. Let me give you the numbers in Weld County, and this is as of today, and this is from the Johns Hopkins University COVID-19 interactive map. To date, Weld County has had over 2,000 confirmed cases and 113 deaths, and that's just to our south. Larimer County to our south has had 437 confirmed cases and 18 deaths. Now, I think a lot of what's going on in Weld County may have to do with the meatpacking plants.
Right.
Because those have been hit pretty hard nationwide.
Now, and again, by the way, if you're just joining us, I'm speaking with Laramie County Health Officer Dr. Stan Hartman. We're talking about the COVID-19 recovery plan. And as the governor said some time ago, this whole thing is data-based and not date-based. I think that's important to emphasize, that we get there when we get there. Is that right?
Yes, we have specific dates when we can begin each phase based on the data that we're following, and we have 5 metrics in those data that we look at pretty constantly. We look at the epidemiological curve of cases in Laramie County, and that is the number of new confirmed cases that pop up, and actually those seem to be trending down. The percentage of cases due to community spread, that is unknown sources, that seems to be level. It's not going down, but it's also not going up. Hospital admissions are down. Percentage of ICU beds occupied are down. I don't know that there's anybody in the ICU at Cheyenne Regional now that has with COVID-19. And then the percentage of COVID-19 tests done that are positive, that's also down. So at this point, I'm cautiously optimistic that we will be able to proceed with phase 1 on May 15th and start allowing some businesses and other organizations to start inching back toward some semblance of normal.
And then if we had 14 days of promising metrics, we could move on to phase 2, correct?
Yes, absolutely. We really want to do this in a very disciplined manner. We want to allow 14 days, again, to make sure that the loosening that we just did doesn't result in a spike in cases. But we do want to keep going, but we want to be driven by data, not specific dates or deadlines.
Now, if we did have a spike in cases, and heaven forbid it was a pretty significant one, would we roll back from the phase 1 restrictions and tighten things down beyond that, or how would that work?
Well, it would depend on how big a jump we got. If we get into phase 1 and all of a sudden we see a huge spike, we just have to look at it. I don't want to say that we would necessarily go back to the way things were, but we might have to do a really deep dive into the data and figure out where the increased cases were coming from, try to figure out what's going on, and then take a reasonable approach to it. What we really want to avoid is having to go back to the type of stringent limitations that we've been struggling with for the past several weeks. We really don't want to go back there.
Now, Dr. Hartman, from around the state, we seem to have clusters of cases. There was a facility up in Casper that had a cluster. There was, I believe, a nursing home in Fremont County that had a cluster. Have we seen any clusters here locally?
I don't think so. It seems to have stayed out of our nursing home and long-term care facilities. We had, several days ago, we had one day when 6 cases appeared, but 4 of those were in a single family. But otherwise, I'm not aware of any big clusters here in Laramie County, and I certainly think I would be aware of them if they happened.
And that's probably good news for us. It's helped keeping our numbers down, correct?
Absolutely. I think that's excellent news.
Okay, again, I'm speaking with Dr. Stan Hartman, County Health Officer for Laramie County. Now, Phase 3 is probably well down the road, but just kind of briefly, because we are a little short on time, what would Phase 3 look like when we get there?
That's really hard to predict. I would hope that there would be less need for social distancing, more liberal seating in restaurants, more people being able to worship together without having to do quite so much social distancing. There would still be increased requirements for disinfecting objects, walls, seats, that sort of thing. Hands, increased need for hand washing. So things would probably never go back totally the same, but we certainly would like to get things back as close to the way people remember them as possible, because we really need to make sure that people can get on with their lives.
If and when a vaccine is developed, would this all go out the window and we just go back to the way things were or not?
Well, I would hope that there are some useful things that we've learned from this. We've learned that simple hygiene interventions like frequent hand washing, cleaning and disinfecting surfaces, staying home from work if you're ill. We've learned that those things are helpful in a pandemic, but those things would stay helpful even when things get sort of back to normal. With regard to a vaccine, we're not sure when that would be, when that would appear. There are some early trials now in some places. I would imagine probably the earliest we would have something for widespread administration would be probably later this year at the earliest, but I'm hopeful.
Okay. And again, I'm speaking with Dr. Stan Hartman. Dr. Hartman, we have about a minute left. Is there anything you'd like to mention that we haven't covered this morning? Or this afternoon, rather?
I'd just like to say that if anybody thinks of any questions that they haven't had a chance to ask, my office email is on the Laramie County Health Department website, and they can click on that and send me questions, and I'll get back to them as quickly as I can. The recovery plan is currently undergoing considerable revision. We're looking through it very carefully. There are some things that no longer pertain, and we're going to get ready to get a new version of that out as soon as possible. A lot of that will depend on what's in the governor's upcoming order.
Dr. Hartman, we're out of time this afternoon. I certainly appreciate your time. Thank you very much.
Thank you for